Yes, I was invited to participate in an educational session on the immune system in myeloma and the impairment of the immune system. And it's fascinating because if you take it from a simple view, you just look at lymphocyte counts. Myeloma patients who have low lymphocyte counts have shorter survival. If you look at low polyclonal immunoglobulin levels, those patients usually have a higher risk for progression. But now we have much more sophisticated means to evaluate the immune system. And when we can decide whether we want to investigate bulk bone marrow cells or bulk peripheral blood cells, or whether we want to use single cell analysis. But of course, the investigation started with bulk cells in the years, some years before, and we have very important information because if you have specific cell types which are prominent or increasing in numbers, like T regulatory cells, like myeloid suppressor cells, or T cell memory cells, then the risk for short progression, free survival, the risk for relapse, for becoming resistant is higher. So, and this is just a snapshot. We need to look at the immune environment as well. So we are in the process of learning extremely exciting data. And when you go to single cell analysis, you can, of course, study very carefully the clonal evolution from MGUS to smoldering to multiple myeloma and during the course of myeloma. And you can study this rise and fall of individual clones, which is very important. So the more aggressive clones, of course, suppress the other clones, and finally they are the winner in this competition. But in the end, they are prone to die because they kill their patient. That is the problem of nasty cancer cells. You can then, for instance, see that if you have, when you do this single cell analysis, you can identify patients who have short progression, free survival, and you can identify patients who will progress from smoldering to multiple myeloma, which are much higher risk than patients with a different profile. So, in a sense, this is exciting news. And what we need to learn is how to modulate the immune system in a more professional way. But because the disappointment was that checkpoint inhibitors are not helpful in general in myeloma. They may be helpful in the beginning of CAR T cell therapy, but only for a short use time. And so there's lots to learn in the future in order to engage the immune system and the stroma in the control of the malignant clones.